So to start with, I'd like to start with Achilles tendonitis, a little bit of a review about it. It's most commonly found when you have pain at the very back of the heel. That's where the condition starts with, is pain from the tendon inserting on the bone and the inflammation there. The tendon is made up of two calf muscles that insert into the tendon and come together to form it. The other one is plantar fasciitis, is a ligament-based pain where you'll have pain at the base of the heel on the bottom side of the foot. The ligament starts at the base of the heel, moves up through the arch of the foot, and hooks onto the base of your big toe. The Achilles tendonitis can be constant pain in nature, usually increases with all weight bearing and motions that make you bring your foot up, like walking upstairs or squatting. The plantar fasciitis pain is usually worse in the mornings when you first stand up, put your feet on the floor. You'll have pain for a few steps. It usually goes away in its early stages. At the same time, during your day, you sit down at your desk and you rest for a while. You'll be pain-free, you'll stand up, you'll be sore again until you get your foot loosened up again. The causes of these two is inflammation and irritation at the insertions of these two on your heel. The problems are most commonly from tightness in the muscles of your calf, tightness in the plantar fascia itself, weakness of the muscles that support your foot and ankle, including the calf, inappropriate footwear. So to best treat this and prevent it, one of the first things you need to do is start working on the flexibility of your lower leg. The two muscles in the calf that come together form the tendon, so there's two different stretches, one for each muscle. The first one is standing with the involved foot back behind you. You need to keep your foot flat on the floor, your heel on the floor, don't let it come up, and keep your toes pointing forward in line with what direction you are facing. Keep your knee straight. You're just going to lean into it and you'll feel it pulling up in the top of your calf, up to the back of your knee even. You'll hold it 30 seconds, perform that 5 times, taking a short break in between. For the next stretch, it's the same position, but you're just going to bend your knee and just lean into it and kind of squat into it. For the other muscle, you'll feel a similar pulling sensation, but it should be lower, down more towards the base of your heel where you're having your pain at. To stretch the plantar fascia directly, the easiest way is to cross your foot over your opposite knee while you're sitting in a chair, grabbing your big toe and pulling your foot up. By pulling on your toe, you may or may not feel a pull directly where you're having pain, but you should feel a stretching sensation along the arch of your foot. So that covers the flexibility of your foot for the most part. The next thing you want to work on is the strength and conditioning of your foot. If you don't have the appropriate strength, you won't rely on the muscle to control the movement of your foot as much, and you'll rely more on the passive tension of the tendon and the ligament to control your foot movement. This also is a big cause of the inflammation at the sites we mentioned before, because you're just hanging on the tendon and the ligament instead of controlling the motion in the foot. So to work on your calf strength, the easiest way is just a simple heel raise, standing at the counter, standing anywhere really, just as long as you have good balance, and coming up onto your toes. I think the picture we have is of, we'll do it on one foot. That would be the best. If that's too painful, don't force through it. Just do it on both feet at the same time and put whatever pressure you can tolerate on your involved foot. You want to build your strength and your flexibility through all this stuff, but without causing increased trauma to the area. So it's kind of a give and take, and you have to realize later if you're excessively sore that you're doing too much and you need to back off a little bit. The same thing with the stretches, like I mentioned before, 30 seconds. If you can't tolerate it, you're just pushing way too hard, and you just need to be more gentle with it. To strengthen the other muscles of the calf that help wrap around the sides of your ankle into your arch to help control the motion there, the easiest way to work those is by laying on your side and bringing your foot up like you're trying to look at the bottom of your foot. So you're curling your ankle up while you're laying on your side and pointing your toes up towards the ceiling almost. You'll flip over and do that on the other side and curl your ankle up the other way. In the picture, we have ankle weights on the edge of your foot around your toes to give you resistance. If you need those may be a good investment, or exercise bands work good for that also. As far as the strengthening, work on higher reps for more endurance to start with. 30-40 reps. If you can do it in one big set, that would be fine. If you need to take breaks, that's fine also. When you can do that really comfortably several times a day, you may need to progress to more aggressive strengthening. Another important part of strengthening are the small muscles in your foot. Your foot should have a natural arch to it that has a good curve. Not everybody has that, but the reason you have that is in part because of some small muscles that are in the foot itself that start there and they end there. To work those muscles, you need to work your toes. So to work those, lay a towel on the floor, preferably a slick surface like linoleum or hardwood, and curl the towel up with your toes like you're trying to bunch it up into a ball. When you get it worked up, push it back out, flatten it out, and start over. With this, it's not as easy to count reps, so I would just recommend timing yourself. Several minutes, 3 to 5 minutes at the most would be plenty. To help control the inflammation, we usually recommend patients try ice. If you use an ice pack, wrap it in a thin towel. 10 to 15 minutes would be a good place to start. I would not go more than 20. Some people also like using a frozen water bottle, just the regular water bottle, freeze it solid, put it on the floor, and just roll your foot back and forth on it from your heel to the base of your toe. A lot of people think that feels really good, and it also helps with the massaging effect. If you look at your shoes and it's a piece of flat cardboard and it folds in half like a wet noodle, it's probably not supporting your foot very well, okay? The things that we recommend when you're looking at shoes is find something that has a rigid arch in it that will give you some sort of support. If you can take your shoes and fold it in half, again, probably not the best. This one, you can see it has a hard shell in it right where the arch is, so it helps support the arch and take some of the load off of it, okay? Even if you buy a very expensive, nice pair of shoes, when you look inside of them, they're all going to be flat. They're going to have just a real thin layer insert in them. That's not going to give you any support either. The gel inserts really aren't good for much of anything, but you may need to buy an insert that will go in the shoe along with the investment of buying a shoe that's more supportive. This is an example of one. You can see how it has an actual support in it. The other ones that are in your shoe, or that you find at some stores, they'll just be flat like this all the way through. Again, it won't do much for you. For most people, a shoe insert off the shelf will work. It shouldn't hurt when you put it in. It should feel comfortable, and it should feel supportive. I wouldn't recommend going by the adage that if it just needs to break in or loosen up or anything like that. Don't do that. Just find something that's comfortable and that you feel like supports your foot. But the big preventative thing, I would say, is probably to start with, if you're not having any problems, would be your footwear. And if you're already noticing some trouble, start with the stretching right away and progress the strengthening and stuff as you can tolerate. So along with the prevention aspect, it's important to start treatment early with these conditions. Like I mentioned before, a lot of times when these start, the pain will come and go. And that's usually when they make it to their healthcare provider, because they've been having reoccurring problems and it's getting worse, is because they've been having the problem for 6 months or longer even, most times. And so just recognizing that the problem that you have won't go away is really important to start treating then, as soon as you notice it.